Hi, hello everyone. Thank you for joining us. Today I have a very nice case. I will not take too much time, but I believe it's very interesting to evaluate how we how how can we do or how we need to do to evaluate the biliopancreatic area when we have some patients with jaundice. Okay, so this patient is a 44 years old male that came because of jaundice and dilation of the biliary tract. So there is two things very important here. So first and all, yes, it is true the biliary tract is dilated, and second one, the main pancreatic duct was not dilated. So when I have this, so we have several reasons of several kind of condition that we need to evaluate. To understand what is going on with this patient, right? So I had a question from my associated Dr. Juan Manuel Alcivar, right? He was asking me because he have some doubts regarding if it was ampuloma or not. So first and all, when I saw that the main pancreatic duct, I was doing with the radial. I will show you my image. Give me just 1 second. Here. So here you can see the ampulla very well, right? I will put bigger. So you can see this is the radial and you see the ampulla very well. So if I go back, I can see here my main pancreatic duct. You see very well. So there are some white spots, right? Confirming that probably it is starting a chronic pancreatitis. I don't know if this patient, smoked. I'm so sure that he smoked or he have alcohol intake. And second, when I was evaluating, so the pancreas, the head of the pancreas was normal, but it called me the attention here. So you can see this is the starting of the biliary tract, and this is part of the wall of the biliary tract. So I see this hypoechogenic, right, nodule here, and that's why I decided to change by a linear US scope, because I need to evaluate well and take a biopsy from here. I believe the problem of this patient is here. This image of is from the linear, so now I am with the linear one, and you can see here this is the main bile duct, this is the wall, and you can see the mass here. You see the mass is growing from the inside. When you have this, you need to suspect that probably this is the starting of a cholangiocarcinoma, and we need to evaluate very well. So I will not just do it FMB of this lesion first, but second, I want to see by cholangioscopy, because I believe it is probably just starting to appear under direct evaluation. So that's why US will continue to be part of the complete examination of the biliopancreatic tract, right? So you can see very well, very dilated, the biliary tract you see here, right? And then you see the pancreas here, the head of the pancreas is doing well, is perfect, you see. But here we see the lesion here, perfect. So now I am here, and now I will try to get my needle. I will use a FMB 22. You see, it's not related to the pancreas. This is very important to evaluate also, okay? So then I will use DF5 a little bit. I want to evaluate if this lesion is have some vascularization, and yes, it have. So you can see here very well. There's a lot of microvascularization here. You see here? Very well. So I will make a small area to evaluate. So there is some microvascularizations inside. You can see here very well. Okay, I will increase my image. You see? You see very well, right? I like to increase the image, so you can see there is vascularization here. This is the nodule from the wall. There is some, you see, features of the, I believe this is neovascularization. So now I will take a biopsy. Okay, préstame la. This is not a lymph node, okay? So this is the area that is that we saw by radial, and now we are confirming by linear, and I will take one biopsy. So after that, I want to evaluate just my cholangioscopy, just to confirm that this lesion is not appearing yet. So I am using a 22 gauge needle now. So now I am inside the lesion, you can see very well. Okay. We'll make an aspiration. And I will try to get good tissue for evaluation. We need to understand if this case is or is not cholangiocarcinoma. This is very important because I believe these patients will be treated by surgery, needs to be treated by surgery. So now we get this. Sure. So now I will evaluate if I have a good tissue. I believe yes. You can see here very well. It's a good tissue. Very good. Okay. So I will finish my transmission. The other parts we will do it inside. And thank you for joining us. I believe it was very nice to show you what to do. But in this case, I believe you know, an ERCP will be fine because we need to see how is the tissue inside now. Okay. So thank you again. You see the bile ducts inside intrahepatic are very dilated. So this is a very tough tissue that probably is cholangiocarcinoma starting. So I didn't saw any lymph nodes in my evaluation, my complete evaluation, and nothing in the liver. So I believe is good. So thank you again, and see you